How to inject GLP-1. I'm Charlene, I'm a nurse. I'm also on a GLP-1 journey. I'd like to show you today the best way to inject. GLP-1 should always be prescribed and you'll receive it. It'll look something a bit like this. You should also have to hand a sharps box, a swab, and your needle. Take your swab. And the first thing you're going to do is just clean the tip of your pen. Keep the swab to one side because you can also use that to swab your skin, the area that you're going to inject. You're going to take the film off the needle. This is a dummy pen, by the way. You're going to place it on the tip of your needle and twist and push on. And then you'll have another cap, usually on top. Sometimes there is no cap, so just be careful, no needle stick injuries. And every time you put a needle on and every time you inject, you're going to prime that needle because there's a tiny little bit of air inside there. There should be no air bubbles in the pen. If there is, you can tap them out and normally they come to the surface. So you're going to hold your pen upright. You're going to twist about 2 times and you'll hear the clicks. So about 2 clicks. So it's 2 clicks there. And then what you're going to do is take the tip off and you're going to press up. Oh, there's still a little bit of liquid in my dummy pen, which is absolutely fine. But that's what should happen. If you don't get that liquid coming through, you just probably want to twist once more until you see liquid come through the needle. You can gently place the cap on top without touching the needle, so the bigger cap, while you prep your area. So there are a number of sites on your body that you can inject, and it's up to you as the individual where to inject. There's no scientific evidence that shows injecting a particular place makes the medication more effective. The places that you can inject are your arms, your stomach, or your thighs. I inject in my thighs, so that's how I'm going to show you today. Okay, without getting my thighs out. So if you was to do the arm, the best place to do it is near the back of the arm, around here. That tissue there. And on the stomach, the best place to inject is either side of the belly button. And on the thighs, the best place to inject is kind of to the side but on the top. Okay, that's where I like to go. So I've put my sharps box to one side and I'm going to show you how I would inject my thigh. You would swab your area a few times, okay, so that the area is nice and clean. You're going to twist the pen all the way until you see a number 1 in the window, okay? And that is your dose for the week. The needle's about 4 to 6 millimeters in size. It is teeny tiny. I would inject into my thigh around the top, so my thigh is here, around the top to the side of the thigh, press it in, and I would push the pen all the way down, holding the pen in this position because it gives you a good grip if you hold it in this position, no matter where on the body you're injecting. And then you would count to 10 seconds once you get all the way to the end. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Remove the needle nice and straight out of your body. You'll then gently place the cap back on the needle and you twist and pull and the needle is now in the cap. The used needle goes in the sharps box, and this sharps box, usually if you click down once, that locks it. And keep this up high, away from children or anyone that can play with this. If you click it all the way down, you won't be able to open it again. You're going to place the cap on top of your pen and then it's ready for the following week. Bruising and redness to the injection site can be very normal. If there is a tiny bit of blood, just wipe it away with some tissue. Do not rub the injection site area. We will talk about reactions to the injection site, which can be very normal. If you have any concerns, please speak to your provider or your GP.